this whole thing that I created a long time ago, okay, it's been 10 years since My Baby Expert started, was never ever intended to be just me. Never. Okay, because why is that? Because one person doesn't know it all. And I know for sure that I don't know it all. There's a lot I do know. There's a lot I know how to teach you, but I don't know how to teach you everything. And where there are experts out there who really specialize in particular areas, I consider it my role, okay, not only to be your teacher, but also to bring you the best in what you need to learn in particular subjects. Today, I have Lisa Paladino, who shares credentials with me, which I love, okay? She is also a certified nurse midwife and an international board certified lactation consultant. So we do have the same credentials and have worked with moms and babies for many years, right, Lisa?
Many years.
many. Add a couple extra pennies on that, right?
Yeah.
And the reason that I decided to have Lisa come on and join us for this particular conversation is because it's one of her specialties is working with moms and babies. And I'm talking for you completely here.
It's okay. It's okay. You know who I am.
I just love Lisa so much. She knows that. So, you know, she's just such an expert when it comes to latching issues for all different reasons. And so I wanted her to come have this conversation with me. So anyway, and before we actually, let's do that. Let's talk for a minute, Lisa, in your experience, and you have so much experience. What would you say is the main reason that moms struggle with latch when it comes to their newborns and beyond?
I think the main reason, especially a brand new baby, might be something that people don't really think about. And it has to do with everything that mom and baby have been through at the birth. You know, some births are very traumatic. Babies go through a lot and they may be tired. They may be affected by birth anesthesia, whether it be epidural or not. They may have had things done to them at the birth that they needed to do. And I'm not saying none of this is, you know, necessary or not. Something to know about that a baby may be just tired. You know, think about how we feel after we give birth, and then think about, you know, the baby's affected too. So I think a lot of babies are just not ready yet. They're just not awake enough. They're just not given the chance, and we're often in such a hurry in the hospital. You know, get that baby fed, hurry, get that baby fed. Mm-hmm. And when the baby doesn't, we don't own process to get to the breast and interfere with that, we set up things for more problems going forward with latch. So Absolutely. We know that the best latch happens when a baby is allowed skin to skin and can find its way route to the breast. Yep. And that sets up a pattern for the future. It's not just about that latch.
Yep.
We set up things for more problems.
What happened here? Okay, sorry.
Did you hear an echo?
No, it was my phone just flipped on. Okay. I'm literally having ghosts in my studio today.
This is the day. If we get through this one. So and I'm very to make sure that I'm not saying anything to make anybody feel bad. You know, and I do this in my office as well. No judgment about the type of birth you had. But you need to be aware of how the birth interventions affect the baby. So you may have needed an emergency C-section. There's nothing to feel bad about that. But just to know that the baby may be reacting to that emergency C-section in the way they latch, because everything is affected by what happens in the birth. So just giving the baby time and space to come to the breast by themselves and not get nervous and not start feeding them by artificial means unless there's a medical reason. All of that helps set things up for a better latch going forward.
You know, I was just saying to Lisa before we went live that some of you were with me last night on Dawn's live stream and heard me say that I finished filming Simply Breastfeeding yesterday. I completed the final 12th chapter of filming on the course. And so you guys are going to have it very soon. Like we're actually in editing. It is going to be ready for you guys really soon. And I'm so excited. But, you know, one of the things that I'm bringing it up is because something that I spoke so much about during that program is the idea of how the birth, and exactly to what you're speaking about right now, how your labor and your birth and that first hour or few hours after birth can have such an impact on your long-term breastfeeding success. It does not mean that if things don't go well that all's lost and you can't breastfeed.
No, not at all.
It's important to understand it, because the interventions that are used, not just C-sections, but just IV fluids, something that seems like such a benign thing, like, okay, so I got extra fluid, I was hydrated. But what does it mean to be overly hydrated, whether it's through a labor induction? It could have been days of IV fluid or C-section, or even when you've had an epidural, you know, there's other things that are done like IV fluids. And those IV fluids can cause swelling in the breast and in the areola that can make it very difficult for the baby to latch. Plus the fact that, you know, and I say this probably 50 times through the program, is that the most important thing that you can do to help the baby to latch better is unwrap the baby, get the baby, you know, skin to skin, allow the baby to be on your body, because it will stimulate all of the baby's natural instincts and reflexes that are there at birth. They're inborn to actually do all the things that we needed them to do to get an effective latch. And what winds up happening, and I'm sure you can agree with this, is that we wrap up babies and we swaddle them tight. And then we, you know, when the clock says it's time for them to eat, we suddenly unwrap them, expect them to just wake up and latch perfectly. And that's just not the way.
Right. Do you know, it's funny because in my notes before, you know, when we talked about what we were going to say, the things I wanted to make sure I didn't forget to say is not to over swaddle the baby, especially in the beginning.
Absolutely.
Because those are the feeding cues. You know, we're looking for feeding cues and we're not going to get them. You know, I wouldn't wake up to eat if I was all snuggled up and warm, you know, and comfortable. So that's key. And, you know, the skin to skin thing, I don't have any tattoos, but if I did, I think I might get skin to skin. So that everybody who came to me would say, what does that mean? So I could explain it. You can't say that enough to get the message out. And the important thing to know, and hundreds of times in my own office, in my own experience, if that first hour is interfered with for any reason, the first opportunity to be together with that baby in that way, you can do it up to 3 months. I've had babies who were NICU babies and mom missed that opportunity, and they come to my office and they're not breastfeeding. And I say, let's just try this. And we just get mom undressed and put baby skin to skin and we talk. Mom and I will talk while they're just relaxing together. And the baby just automatically knows what to do.
Totally.
So always recreate that experience, whether it's 3 hours after birth, whether it's 5 days after birth, whether it's 2 weeks after birth, you know, and that's important. Like, make believe it's the first time and start over, because babies know what to do.
Yep.
You know, they really do.
There's actually research that was done that shows that when the baby is skin to skin, but also in the position of being on top, meaning in a laid back position where the baby's laying on top of you, in that position where they're not back underneath the breast, but on top of the breast. It stimulates reflexes that the baby has to throw their head back, to latch on good, to use gravity, to pull them deeper onto the breast, onto the areola, to get it further back in their mouth. And just like Lisa's saying, those reflexes and that stimulation does not stop the first hour. We know that it actually starts the first hour, right? And so that first hour is important, but it doesn't stop. And so you can keep coming back to it, to, like she's saying, to use and like, you know, use it to your advantage. These are the things that nature has given us to make it easier. It's that we kind of like don't know about it. And I go over it quite a bit in Simply Breastfeeding, because I think when I sat to think of like, what were the most important things that really needed to be conveyed to new moms that they may not be getting from their obstetricians, even their midwives, or the hospital staff, or they may never hear about it anywhere else. It's that, how do I let my body and my baby do what it's naturally meant to do, to at least give me the best chance, the best starting chance?
Right, exactly. And you know, I don't know if I've ever told you this, but when I used to be the only lactation consultant that worked in a pretty large maternity unit. And I would get called up to the floor and they give me a list of rooms to go see, you know, the one in room this room. So I would start in the first room, go in, get them undressed, unwrap the baby, go put each baby skin to skin and go down the hall and do that. And then I'd go back and ask the nurse, does anybody, oh no, this one's fine, that one's fine. It works like 80% of the time. It's pretty, you know, that those babies just latched. And there was nothing more for me to do, you know, and it's like that, it's that simple. And it's not that simple for everyone.
No, but it's good.
But it can be that simple, you know. So that's fun. And those experiences of the baby that hadn't ever latched before, when that baby latches on, it's so amazing to watch how smart the babies are, how they know what to do. It's really cool.
I want to take for a moment. I want to just move beyond like what the normal setup would be of like, here are the things that we can do, and there's more, and we're going to come back, circle back again to, okay, beyond skin to skin, beyond that, what can we do to help get a better latch, and what does a better latch even mean? All right, so we'll talk about that in a minute. But what I want to do is I have somebody waiting here to talk to us, and I really want to bring her in. This is somebody that I met recently and has an amazing product, okay, that I really want to show you. We're not doing it as a giveaway, and there's a reason that we're not going to do it as a giveaway, because this is something that is more of a medical device, and it's a genius thing that she created. And I want you guys to know about it, because with the proper supervision and support, and like if you're working with a lactation consultant and you really are struggling to latch your baby, this can be such an amazing tool to be able to use so that you could get your baby to latch and not have to turn to supplementation or a bottle, which will only make the problem worse. So I'm going to go ahead and bring Kate on with us, and I know she'll be fuzzy too, but she could just join the party here. Party, you know, that's what it is. So Kate, let me pull you in here. Here she comes. Okay.
Here I am. Hello.
Hi, Kate.
Hi. How are you?
Good.
Nice to finally meet you, Kate.
Hi.
Yeah. So Kate is. What? Can you just do me a favor? Introduce yourself.
Sure.
Tell us about yourself and your credentials too, because you guys have a pretty good panel here to learn about breastfeeding today. So.
I'm Kate. I'm a physician assistant and an international board certified lactation consultant. I am also a mom of two breastfed babies, one of whom I'm still breastfeeding now. And I created this product that I thought could really help a lot of moms, because I have a practice in New Jersey and I would see moms struggle with the same issues over and over again, mainly the latch and the supply. That's kind of, what we see a lot. So I said, wouldn't it be great if there was a way that we can kind of battle both of these issues and without interrupting the breastfeeding process? So the idea is the bridge, which you can see. It helps you keep the baby at the breast for as long as possible. And like Lisa and Shari were mentioning, it helps you with that skin-to-skin time. And instead of having to use a bottle afterwards, you can give the milk directly to the baby while they're feeding. And that helps you to stimulate supply too, because the more you empty the breast, the more milk your body is able to produce. So that's kind of how it works.
I think this is so great. And what we're talking about here, and many of you will know this term more than the bridge. The bridge is the product that Kate created, but it's a nipple shield. And so you've heard people talk about using nipple shields when they're struggling with latch, when they're having difficulty getting the baby on, or other reasons, whether it's painful, cracked nipples. There's different reasons to use nipple shields. But you're going to use it with you want to make sure that you're getting support. I want to keep saying that, because I don't want moms to think that because they do sell nipple shields. Like you walk into a store, order it online, and you could just use it yourself. But I do think it's important to always understand, if you're having issues latching the baby, that you find out what the cause is too. You know, that you're working with somebody to figure out what is the cause of the problem. And I think that you just mentioned, Kate, that you're using this also to supplement the baby if the baby needs to be supplemented with afterwards after a feeding.
Right, exactly. So if you're having to breastfeed your baby and then you're taking them off and you have to give them extra milk or formula by using a bottle, you can do it directly at the breast, and that keeps you skin to skin longer, and it keeps that stimulation of the breast longer too.
So great. So great. And they're going to continue to get more breast milk while they're doing this as well.
Exactly. Absolutely. And, there's just different circumstances, and you can use in different circumstances. For example, if a baby's just used to a bottle and they just don't latch because they just want that instant gratification, you can put the baby on the bridge, give them a little bit of milk, they start sucking, and so, you get a letdown. And so the baby just continues feeding, and you don't have to give them extra in that situation. Or it might be, like Lisa was mentioning, it was a sleepy baby, and like they're latched on and they do a little bit, but they don't want to go all the way. And so you can give them a little bit at the end to keep them interested, just to keep them going, to keep getting that stimulation, increasing their supply.
What's been your experience with the bridge? I know you're an IBCLC, and I know you've obviously worked with moms using this. What kind of situations have you used it in, and how has it helped?
Mainly, it can be used for any baby that needs to be supplemented, and also a baby that's not latching to the breast. So when, just like we mentioned earlier, we said, that feeling when the baby has never latched and then they latch and you're like, yes. Yeah. So that's kind of what this gives me all the time. Yeah. We put the baby to the breast, and the mom, if you just usually, they'll fuss and they'll cry, and you put them on and you give them a little bit, and they're like, oh, there's milk. And so they start, feeding. Yeah. And it's such and the mom, is crying. I'm like, yes.
Yeah. Isn't that wonderful? She's crying, you're crying.
I know.
I could think of situations, like specifically moms who've come to me who literally are exclusively pumping. Their baby won't latch to the breast at all. They've been giving bottles since day one. And really the baby, remember, babies develop a nipple preference pretty early on, within the first week or two, they develop a preference, and that's going to be, you'll see it in both directions. You'll see breastfed babies who will reject a bottle after a certain amount of time, but you'll also see babies who are given lots of bottles rejecting the breast. They don't suck the same way on a breast and on a bottle. And I can think of when I've had these moms come to see me who are really want to get back to breastfeeding. They don't want to stay exclusive pumping for the entire time that they're doing this. I could see how this could be really, really helpful beyond just using the Shield, which is more familiar to a bottle-fed baby, to be able to make that transition. But also the fact that, when you nurse, it takes a few moments let down, and babies that are taking a bottle are not used to waiting for that, and so they could often not want to latch even with the Shield, because there's just that time that it takes to have that milk let down, where that little bit of a push I could see could get them like, oh, I get what we're doing now. I get what I'm supposed to be doing, and have them start sucking, which would initiate the letdown reflex. So
exactly.
And you know what? To add to that, I use the nipple Shield often, and I haven't tried the bridge yet. I have one. Kate dropped one off to me, and I didn't have the appropriate patient to try it on yet. But I use a nipple Shield as a transition for those bottle-fed babies. And sometimes a baby who's got a weak suck can't get milk through the Shield. So I'm really excited about this, because it will help provide that instant gratification to keep them, to motivate them to suck, which, I've had babies that, well, let's try the Shield. Yes, they can latch to the Shield, but they give up because the milk's not coming through, even though mom has milk.
Exactly.
So to give them the milk while the stimulation is going on is just incredible to me. And I know a lot of, I'm not usually a gadget person. I don't usually like to use different gadgets, but I'm very excited about trying this, because there are supplemental nursing systems that I'm hesitant to recommend to moms because they're very complicated. And this, Kate, I congratulate you, because this seems so simple. I've looked at it. It's easy. There's no needing to figure it out. There's no real setup or anything. It's so straightforward to use, and it's right there. It's not like you have to set something up and worry about it. So
that was the idea. Yeah, because I would see moms all the time, and we would do like another system, and then I would see them, and they're like, "Well, it's great, yeah, and it works when I use it, except I can't do that 10 to 12 times a day."
Right.
And so
I
was like,
so hard anyway, right? The triple feeding with the pumping, it's just too hard to add something that complicated, especially for new moms. And I don't mean to say it like in a down, that moms can't handle it. I mean, handling it in the beginning when you're overwhelmed and not sleeping and everything is new to you, So
it's hard.
I'm excited.
I'm a lactation consultant, and I was a lactation consultant when I had my first baby. When it's your baby, it is tough. It is tough.
Yep. I want to just the thing that's so great about it is that, like you said, you can use it with, it looks like it's like one hand, right? And then there's times where you have multiple issues. Like, I'm just thinking for myself, like there's times where, you'll have moms that come in who have supply issues. So the problem is low milk supply. It's not that they can't latch, but then there's times where people have a good supply, but they're having trouble latching. But then there's the times that because of a bad latch, you also have low milk supply. And now you've got those double issues. And that's a really challenging one, is when they won't latch and the supply is low. And so you're trying to give extra breast milk or formula through a supplemental nurser with a nipple shield, and the two just don't go together.
No.
I mean, like, I don't know about you guys, but I struggle with that, just to figure out how do you get that to happen. That's what I think I was really excited about, because it's the one challenge that I really struggle when moms really have all the issues piled on top.
Absolutely.
And then, to reiterate what you said about needing support with this isn't something you want to just pick up and let's see if it works, because, there's a fine line between teaching the baby to feed at the breast, using the bridge, or just like boiling a baby and giving them too much, that way. So a professional who can judge what's going on is so important with a device like this.
Yeah, absolutely. But we're doing an educational program to really try to explain, in which situations you use it and how you would use it, just to make people aware. Because absolutely,
the thing that I could see people using this for, beyond just latch, is what Kate brought up at the beginning. And I hadn't really, I did think about it, but as I think about it more, it's like, if you really do have a supply issue, and if I had to choose, let's say this, okay? If I had to choose and you have any kind of breastfeeding issue, then my first choice is that you go and you work with a lactation consultant. Now, let's look at reality for a moment, because, there's like the ideal, and then there's the reality for so many women who may not have the resource available to them. And I know that. And I think, and then they're getting the advice to supplement their feedings, or they need to supplement their feedings for whatever it is, whether it's donor milk that they're receiving or formula. How are they going to give that milk to their baby after they nurse? They're going to wind up either giving that baby a bottle and topping off that whole, idea of it, or cup feeding. But most people are not going to choose the cup feeding. So they're going to go to a bottle. To me, it would seem like using the bridge with the donor milk or the formula in it is going to be a better choice than going and giving a bottle after feeding. Again, to Kate's point, it keeps the baby at the breast, which there are many benefits to just being at the breast beyond the milk, but also the stimulation to your breast while you're doing that will help with the supply issue that you might have, and that might be the whole reason that you're needing to supplement.
Absolutely. I've had so many moms come who have to, they say, we're at the hospital and the baby's blood sugar dropped, and so we had to supplement, and so we gave a bottle. And so in that situation, I think just, using something like this keeps the baby at the breast. A lot of the times moms aren't told that, if you're giving a supplement, you have to be doing something else. You have to be expressing or, pumping or something. So this, you give them what they need, but also keep that stimulation going so that the milk comes in on time.
I really like it.
Kate, are there any plans to get these into hospitals? How great would that be?
Yes, absolutely. It's a plan in progress. Absolutely.
Yeah. Because what I'm thinking, we have some moms who even prenatally express colostrum to have ready if they know, let's say they're a gestational diabetic, or they know they have problems, or their baby may need supplementation. and they get the milk, the colostrum ready in syringes, and they could just hook up those syringes right to the shield.
Yep.
Like you said.
Absolutely.
And those volumes of colostrum, even that are hand expressed in the beginning, are too big, too little for a bottle. So this is perfect.
Yep, exactly. And the syringes, it's very easy to swap out. You can put any, there are a multitude of sizes you can use it with too. Like you said, because sometimes you just need colostrum. Sometimes it's that baby that's transitioning and needs like a 20 cc's or an ounce. And then sometimes it's a bigger baby who, with a mom who's exclusively pumping and she needs more.
Right.
Hey, first of all, I just want to congratulate you for doing it. Thank you for contributing to the world in such a wonderful way for so many people. I can see how this is going to help a lot of people, and I'm glad that we are going to work together to do that and bring this out. Thank you for doing that, and thank you for joining us today. It was really great to have you on.
Yeah, same here. Thank you so much.
Oh, absolutely. Absolutely. We'll see you soon. And if anybody needs to get the bridge, if you're looking at this and you're thinking that's what I need to be doing and I need to like look into this, or I want to talk to my lactation consultant, I want to order one. The links today, if you just do #MyBabyExperts, you will have links to see video on this. You'll have more images, and you'll also be able to go and shop now. And I know they're doing free shipping for the whole month of August. So just do #MyBabyExperts, and you'll get the message from me that you could check out after the show today. Thanks.
Thanks. Happy Breastfeeding Week.
Okay, yeah, happy Breastfeeding Week. Exactly.
Nice to meet you, Kate.
Yeah, thank you.
Perfect. Bye.
Bye.
All right. Awesome. Isn't that great?
That's so exciting. I'm so excited about that. I'm going to follow the link. I'm definitely getting some.
Yeah, no, I think it's really something that more people need to know about. And I love like the multiple, there's so many uses for it that I can see. Let's go back to let's just see how everybody's doing. How are you guys doing?
Lots of comments.
Lots of comments. Everybody's very active today talking about all of this and sharing their experiences and what they've actually done and experienced. Let's talk a little bit about what you commonly see, what I've had you on for before. Like what else beyond just going off to the wrong start? Before we go into positioning and things like that, what could really be going on with mom or baby that is beyond mom's fault?
Right.
That is causing her to have a difficult latch, a painful latch, a shallow latch, all of those things.
So the number one thing that I see is tongue tie and lip tie, in babies who are having difficulty latching. More babies than I want to even know. I examine babies now and I'm like, oh, I hope he doesn't have a tie. And usually he does. So that is a very, very common issue right now. We don't know why it seems to be increasing, but it does seem to be increasing. We don't know if it's environmental, but it's definitely increasing. So if the baby isn't latching, and somebody is telling you they examined the baby and there's no tongue tie, I would say keep asking, keep looking for other professionals who may know. I have a very active Facebook group about tongue tie, if you want to come over to that, because there are certain professionals who have the education and the knowledge of how to do a proper assessment, but most medical professionals, including doctors, midwives, and a lot of lactation consultants, haven't gotten the training to assess for tongue tie. So what I find is a lot of families come to me and say, oh no, my baby doesn't have a tie. They looked for that in the hospital and my baby doesn't have a tie, and the baby does. So don't stop at that. There's got to be a reason that the baby's not latching, and beyond. If the simple things like changing position and making sure the baby's awake and all the things aren't working, then what is it? There's got to be a reason, So I like to just keep saying, just keep asking and keep hope, keep looking for that person that will help you find out what the reason is, because there's never not a reason.
And what I want to say too is that, breastfeeding should not hurt. Okay.
Yeah.
This idea that like, it's just normal. Like you're supposed to be in pain and not enjoying this. And like, it's supposed to hurt. And it's just going to take a couple months. And then That's not true.
Right.
Can it be uncomfortable a little bit in the beginning? Yes, of course. It can be uncomfortable. Your body's getting used to something you've never done before. Can it be uncomfortable if the baby's not opening their mouth wide and they have to suck the nipple to the back so that beginning of feeding hurts a little? Yes, and that can be fixed with better technique and position and all of that. But if you are in pain through a feeding, if your nipples are cracked or bleeding, okay, all of that is not normal. Those are signs that your body's giving you saying something's not right. You need to fix this. And it's beyond just your own comfort. This is, it's the fact that when it hurts, the baby's the pain is actually telling you the baby's not latched well, which means that the baby's not getting milk out the same way, which means you're going to be getting not enough milk. And then over time, you're going to be making less milk. So it's a whole spiral that really starts with that pain that your body's giving you the signal about.
Yes. Yeah. I try to make sure that women say, when I hear, oh, it's okay, I can handle the pain. So it's not just about you, it's about the baby, because the pain is a sign that the baby's not nursing efficiently. So it's for the baby too, because if it hurts, it means that the baby is struggling, and we don't want the baby to struggle to do what it wants to do naturally.
Right.
So you know how much another shameful plug, I feel so strongly about this that I wrote a book called It Shouldn't Hurt to Nurse Your Baby, because I was fed up with hearing people say, oh no, it's supposed to hurt.
Yeah.
As you say, a little bit of discomfort, maybe some soreness, even some chapping of your nipples in the beginning, maybe, but it shouldn't be painful. And it also inhibits letdown, because that pain response blocks the hormone of oxytocin, which lets milk let down. So it's not something to tolerate. It's not good for you. It's not good for the baby. It's not good for your milk supply to be in pain.
Yeah.
And then one thing popped into my mind when you were talking about positioning and not opening the mouth wide enough. A lot of times what I see is babies have some birth trauma or maybe position trauma from how they were in utero or how they came out, and have a lot of tightness in the upper body or the back or the spine. So I always refer babies who are having trouble latch to a body worker. I have a very good pediatric chiropractor that I recommend in my area. There's a lot of pediatric chiropractors that are very comfortable with adjusting babies, or occupational therapists, or there are craniosacral physical therapists. There's all different types of body workers that are very comfortable with gentle treatment for babies. Sometimes it's just a matter of positioning and gentle massage, but there's lots of stuff that can be done to help that baby relax everything and open up. Because if baby's tight like this and they're trying to put their head back, they can't. So they can't get that latch. So when we relax everything, the head can move. The head can turn side to side, both ways evenly. Some babies have what we call torticollis, where they can't turn their head one way or the other from being in a certain position. So that's very important to address too. And it's something that your pediatrician may not think of because it's a little outside the scope of what we learn in traditional medical training.
Absolutely. No, it's such a good point. Babies are latching with way more than their mouth.
Yes.
And you need to realize that they need to be in the right positioning. And that includes being able to put their head back, to be able to keep their head straight, that their heads are not going to the side and that they're nursing like this, these are all really important things. And so much of the focus is just about the suck. It's not just about the suck. And so a couple of things, let's just go over for a minute, like some of the things to look for when you're latching your baby, to know like what are some of the ways that we position and bring the baby to the breast, and what are we looking for to see that it's a good latch?
Yeah, the first thing that I would say, what you just said, is bring the baby to the breast, not you to the baby. So I see I'm going to come back a little bit. I see many moms going like this to feed.
Yeah.
You want to bring the baby to you.
Yes.
And then, so you get comfortable, bring the baby to you. Always have the baby facing you completely, not turned away a little bit. So you wouldn't want to put your head this way and your arms this way for the baby. Yeah. But everything lined up, head, shoulders, hips, all in a line, facing you completely, and nothing between you and the baby.
Yeah.
Either side of the breast. So no breast under, hands underneath and the baby going like this. I should have brought my baby model out. And also the baby being able to put their head back. A little bit of hyperextension of the neck. So not like this. So you want the baby to come up and onto the breast, not squished down like this.
Yeah.
So that's my...
When the baby's on the breast, the baby's head should be in this position, not in this position. I don't know if you can see what I'm doing. And what you want is, so say this is your breast. You want your baby's chin buried into the breast with their nose able to breathe. Okay, so the sort of like an asymmetrical thing where there's more of the areola or the area around your nipple is going into the baby's mouth on the bottom where the chin is than on the top. And the baby shouldn't be smushed into the breast, because when their head is this way coming into the breast, there's a couple things that wind up happening. They're leading onto the nipple with their hard palate versus their tongue, which is, the tongue is what's compressing and causing the milk. It's what pushes the milk into the baby's mouth, actually. It's what's compressing it. And when they have their head tilted forward instead of tilted back, they can't breathe because they're buried, their noses are buried, and they're going to wind up pulling back. And then the other thing, the last thing is, everybody out there right now, if you're watching, put your head down like this. Put your head down, and while your head is down, try to swallow. It's really hard to do when the head is down towards the chin, when the chin is down towards the chest, versus extended up, and the ability to suck and then swallow easily.
Yeah, and then picture there's a nipple in your mouth, and think about what happens to that nipple when you go down. It gets pulled down and twisted sometimes. And so that the more flex the baby's head, if the baby's head is back, then your nipple can go deeper in the baby's mouth, which makes for more comfort and better stimulation of that areola around the nipple, as you said before, where all the milk ducts are. Yeah. So it's just a win-win situation if the baby's in a good position. And I remember way back, now my oldest is 28 years old, so I knew nothing about breastfeeding when he was born. And I was a nurse for a lot of years when he was born, and I knew nothing about breastfeeding. I used to help other moms breastfeed, and I didn't know about breastfeeding. But I remember the nurses showing me how to hold my breast, to push it back so that his nose could get air so he could breathe while he was nursing. If you need to do that, it's wrong. Baby. So it's a miracle that he got any breast milk with what I knew. And I don't want to tell you the horror stories of what I did, but bottom line is, if you're worried about the baby being able to breathe because his nose is squished into your breast, then he's not in the right position. You should
never need to create an airway for your baby to breathe while latched to the breast, no matter how hard your breasts are.
Right.
Period. Yeah. So if your baby is, and you can also, once the baby's latched and all, this happens all the time. You latch the baby on and you can see that the baby's not in the right position. You don't need to take the baby off. Typically, you need to move the baby so that the head's going from this to this. So you're sliding the baby in whatever direction will cause the head to go up a little bit. And that should usually fix it right there.
I love laid back position. It works great for most babies where they lay on you because they can't help but do this with their neck, and come up and onto the breast. And that's a very comfortable position. And for brand new babies, especially small babies, I like football position because mom can have more control and getting the baby in a good position where their head is back. And the other thing that I see a lot, and it's a weird, almost instinct thing, like we're all very afraid of the baby's heads. And I'm going to say this, hope nobody gets insulted. I say this all the time in my office. I promise you, your baby's head is not going to fall off. Like everybody wants to hold the baby's head in place. And the baby, if you hold the baby's head in place, they're going to have a hard time feeding because they make adjustments as they're eating. And they know what it feels like and what they have to do to get the milk properly. So if you're holding the baby's head in place, first of all, they're going to put their head down because that's the kind of reflex that isn't documented, but I know it. You touch a baby's head, they go like this. And they're going to get into odd positions that's not going to be the best way for milk transfer, but they're also going to hurt you. And sometimes they'll just shut down and pull off because it's just not working. So try not to hold the baby's head. Hold right at the bridge of the neck, upper back, and let the baby move their head as they're getting on. Afterwards, if you want to cradle your arm around them, that's one thing. But when you touch the head to put them on, it's not helpful.
Yeah, it actually inhibits a lot of those natural reflexes that they have when they have their hand on the back of their head. And it just goes to show you, like, everybody has their own techniques and ways of teaching things too. Like for me, I don't typically teach the football position. It's just not a position that I use. I find it hard. I find it difficult with my moms to have them use gravity in a way, to bring the baby closer. One of the positions that I teach is that I really like, if you're not going to lay back, is a cross cradle position. Using a pillow that really sits like right under your breast, like high up, so that, and I actually exaggerate it. And it's so interesting when I look at, like, I've been teaching this for such a long time, and it's only now that I've been doing the program again, after all these years, that I really get some of the, sometimes you just do it because you're doing it and it works. And then you come back and you go, okay, well, why is this working so well, right? With the pillows that go up under, a nice flat supported pillow that goes, like the breast frame pillow that goes under your breast, laying the baby on there and then actually sticking something underneath it to even exaggerate it more, where the baby's rolling into you. It seems like for me, the moms have it's almost like a simulation of laid back nursing, where the baby, you're using gravity, but in a sitting position to pull them closer, and gravity's pulling them closer onto the breast. You're also getting that feeling. What the baby needs is a feeling of touching you from head to toe. They need to feel their body against you, and that actually triggers the reflexes to throw it back and to latch and to go into that position. And so if you're using the breast frame pillow and you're following any of my instructions and you're wearing it around your waist and you're leaning forward, that is not the right way to do it. You really got to lift that pillow up under your breast, even stick another like sofa pillow or a little pillow underneath it to bring the pillow up high and have that baby roll into you. It's also why it works so great for football with multiples. When you have the twin one, it actually rolls them towards you. And so that, again, that gravity is pulling them into the breast. I think it's one of the most important things is making sure that somehow you're supporting their back and like Lisa was saying, their neck and their upper back, and being able to really pull the baby in close. The baby has to be like smushed into your body.
Yes, absolutely. And the other thing that I've discovered over the years is if a baby's feet are hanging, they're not going to latch.
Yeah. So
the baby's feet, you said about everything touching, the feet especially. If the feet don't feel supported, baby's not going to latch. Which I think that's why I like the football for the little guys, because if mom is leaning back in football and there's a couch behind her, the baby's feet will automatically be against.
Oh, yes. If she's leaning back, I completely agree with you. That's the problem I see is they're doing football and they're leaning forward. And I say, if you're going to do it, you do have to lean back.
Yes.
In order to get that positioning, for sure.
Absolutely.
At least I want to say something while they're all here for a moment, because we have, there's we're talking about so much right here. You know what I mean? Like there's so much information, and moms just, they need this so much. And that's the reason why I refilmed the class again. And you guys, I'm going to have the first chapter up so that you guys can watch the first chapter, and then I'll have the rest available probably next week for you to watch for free. Okay. But this week we also announced that the membership is starting. Okay. And there's a short window, and I really need to tell you about this. Okay. The My Baby Experts membership site is almost ready. We're putting the finishing touches on it. That means all of my content. That means all of my classes, my library with 1,000 videos in it, all the Q&As that we've ever done. And I've time coded all of them for you, so that things like this. Imagine if there's like 200 Q&As that I've done in all these years, and you're like, what did she say about that thing on that one show? Okay. I made it easy for you. We went through, and with some of your help, we have time coded every single thing I've ever done so that you will have search functionality to find it all. And then I also have Dawn, who is a speech language pathologist. You guys know Miss Dawn, and feeding specialist, and she's actually joining me. And we are going to be offering you feeding from pregnancy through toddler, okay, in everything in between, to be able to help you with all your feeding needs. And I know you guys are super excited about this. I'm really excited about it. And Lisa's going to be there with us too, doing tons of stuff with us. But I want you to know that we have a short window, okay? This Sunday, the door will open for you guys to join. And it will only be open for 4 days. We are doing a founders launch. That means if you want to be a founding member in the My Baby Experts membership and community with me, you only have 4 days to sign up. And then after that, we're going to close the doors for a couple more months while we finish out all the content and all the functionality and get all the founders' feedback on what's working, what's not working, what do you guys want. And so I'm really excited. I hope that you guys are going to join me and sign up for as a founding member. And I just wanted to get some feedback from you. Have you already signed up for the wait list? If you haven't, it's a link that you have in your tool today. So you could just do #MyBabyExperts, sign up for the wait list, and then that way I can message you on Sunday and let you know that the card is open, because I know what's going to happen. You know what's going to happen. Like, I'm going to have a whole bunch of people on Thursday say, oh, I didn't know. And we're not going to open it for anybody. Okay. Plus, we're doing it at a price that will never be again. Like, it's the lowest it'll ever be offered. You will be guaranteed that, and then you'll always have it for life. So you'll never be charged more than that. And you do get access to everything we've ever done and anything that we're ever going to do. Okay, that's all part of the membership. Okay, you guys said you already signed up. I'm so excited. I can't wait to see who's coming. Like, I'm looking at all your names. I see you guys all in the groups. I see you all here on the page, and I keep thinking to myself, wonder who's going to join and join me. And I would really hope that it's you. I really want to create something amazing for you, and I need your help to do it. We're going to do some behind the scenes filming with Dawn and I. We're going to have just a really good time, and special giveaways, exclusive giveaways just for founders. You'll always be that founding member, and there's going to be a lot of perks with that. So excited.
And I saw a sneak peek of chapter 1, and it's
amazing.
I loved it. So I think it's great. I'm so excited for you, and I'm so excited to be a part of this in any way, because you're doing great work. And we know by all the comments going on today that we're probably not going to get to any of these questions as we're on, because it's so long, but there's such a need, and there's so much information, and we could talk for hours. Well, and not cover every topic.
This is what we're going to do. You know, this is what we're going to do in the membership. So, like, you guys know, we have the page here. We do the live streams once in a while. We also have the private group. If you're not part of the free private group, My Baby Experts community, go join. Amazing. So many amazing moms. We've got over 8,000 moms now, and they're just such an amazing group. To have 8,000 people who are so kind to each other all the time and supportive, it makes me just, I don't know, I love it. But we will also be part of the founding members in the new group. It will be a new Facebook group that will just be smaller. We will be in it. These are where we'll be able to take some of these questions that we can't always get to on these large streams. All right. So I encourage you, whether you are pregnant right now, you're just started nursing, or maybe your baby is ready for solids. I mean, it's again, perfect timing, because Dawn is prolific in what she knows. I mean, like, and that's the part is, again, like I said, I like to bring in people who know something I don't know, because I need you to learn everything. And so when we think about Dawn, and, you know, you start to introduce solids and baby-led weaning and all the things that, and picky eating and all the things that go with feeding. Okay. Really what we're talking about here is you as a feeder. You know, the baby is the eater, but you are the feeder, and we are trying to help you to feed, right? And to nourish that child. It doesn't stop when breastfeeding ends, or it doesn't stop when they start to introduce solids. You're still needing to know that all the reasons why you feed a certain way, what you're looking for in readiness, reading your child's signs and developmentally. All of that is still important. And Dawn just, I mean, when she starts to talk about this stuff, mesmerized listening to her about it. So I am excited, and I hope you guys will join us. Yay. Yeah, and Stephanie's saying, I love that between you and Dawn, you have experts from pregnancy through solids and feeding, for solids for feeding. Exactly. And that's the whole point here, is that we want to be able to continue with you. And then, you know, and then have Lisa join us, and just really real experts, because that's what you need.
Yeah. And, you know, you said before, anyone that claims to be expert in anything, move on from them, because nobody is expert in everything. And,
exactly.
You know, the people that I network with professionally, I learn from them. They learn from me. We benefit from referring to each other. So, you know, that experts window or umbrella is so important. It's not, It could never be just one person.
Nobody can know everything.
Right.
And if they claim to, then there's something wrong, like Lisa said.
Yeah.
Oh my gosh. All right. Well, I just want to tell you, Lisa, it was awesome having you back here with me again, and we will keep doing it. And I'm going to figure out what's wrong with these live streams and this internet. Because, we need some clarity. Okay. Just like clarity in what we're saying. We have the clarity in what we're saying. Now we need the clarity in the visual.
Sounds good. It was fun, Shari.
Oh, it was so good to have you. You guys, make sure.
Thanks for everybody who tuned in. So many people. You know, this will be on the, you know, maybe we can go in the page a little bit. And I can go back and see if there's any
answer some questions, or we can even bring it over to the group and do another, like, you know, follow up with some of these questions. If you guys haven't joined the private group, please go do that. And then maybe we'll have Lisa come back and we can just go through all the questions that were posted and answer.
Yeah. All right. Thanks so much, Shari.
And make sure you go follow Lisa too. Okay. She's tagged here in this post. Make sure you follow her, join her community, watch her. She's got a whole course on tongue ties and lip ties that is really, really good. If you're thinking you're struggling with that, I encourage you, like I said, learn from the expert in what they're teaching. And that would be Lisa.
Yeah. And you know, I have a new video on my page. I'm not sure if that's what you linked to. That's free and just says, you know, just how to tell if possibly your baby has a lip or tongue tie. Yeah. So that's a great way, you know, to just find out for yourself by the symptoms and signs that I go through on that video. So that's just on lisapaladino.net/tongue tie. And
will you put the link into the post, into this comments here afterwards?
Absolutely.
Post it as yourself, so they can see that they can get the links from you.
Okay.
Yeah.
All right.
And if you didn't enter, remember, we're giving away the I can't even talk anymore. We're giving away the nursing wedge, the hands-free nursing wedge. You have to just type #MyBabyExperts and then comment here and tell me why you need it. Okay. And we'll be giving one away. There's one here, one on the page, and one in the group. So 3 to give away today. All right. Awesome.
All right, Shari. Thank you. Okay. Have a great rest of your day.
See you later. Bye.
Bye.
Oh, now my mouse won't work and I can't shut it off. I'm not kidding.
Oh, there we go.
Okay.